Hello friends, David Bailey has quoted, "The best advice I ever got was that knowledge is power and to keep reading." Now, when you talk about the knowledge of medicine, we need certain information, and after reading this information, we can get the knowledge. So, now this information can be derived from various sources. So, I believe that currently there are four types of sources. One is textbook, another is desktop, then we have a laptop, and the fourth one is mobile. Now these all four sources are important, but when we think about the situation, then I believe that mobile has certain advantage. Okay, so now let's see what are the situation where we need this information. So there are several situations in our routine life. One is at the time of our work, like during seminar or some clinic or some kind of hospital rounds, we need this information. Second thing is at our desk station, where we need this information. One of the very most common situation is at the time of meal, where we need the access to the sources. Another one is traveling, where we are making some kind of note and we need the information. And last but not the least is at the time of bed, where we might need the access to the sources. So now we have to know that what is the best option in terms of right, rapid and accurate information. So we have total three options. One is this desktop, books, laptop and mobile. So when we are applying the criteria of right, rapid and accurate information, then I guess book is not the best option, neither is laptop or desktop. And I believe that mobile is the best option for this information in this situation. So today we will discuss about selecting best mobile app for medicine information. And this is important because right now there are 40,000 apps in the market and we don't know which one is the best mobile app. So we will discuss about one article where it is discussed which one is the best mobile app. So article was published in Journal of Thoracic Innovation and Regulatory Science, where the author discussed about mobile medical application for dosage recommendation, and they have also given a comparison among the various mobile application. So we'll discuss about the methodology. So what author has done, they have selected around 358 apps, and when they apply some certain criteria, then they narrow down this list into only 8 apps. So we need to discuss which are these 8 apps and how one is different from another app. Now in this table the information is given. Now in this table you can see there are 8 apps and there are certain criteria. So when we apply this criteria, then I believe the first 4 apps are good, because the total score of is 17, and out of the 17 the 4 criteria is having 14 score. So when you think about these apps, then Macromedex, the Macromedex is very good app, but it has some disadvantage, like it does not give free installation, but I believe it is still worth to try. Then other disadvantages are dose calculator and the drug picture. It doesn't give, but rest of information it gives, so it is the best app. Second is Epocrats. Epocrats is excellent app, but it doesn't give information about interaction classification and clinical teaching advice. Then Lexicom. Lexicom is a very good app, but like Macromedex, you have to pay for it. Then drugs.com. Drugs.com is fantastic app, but the only problem is that it is not offline. Yes, it is not offline, so you have to have access to internet. So it might be difficult in some scenario where internet connection is not there. Then we have Medscape. Medscape is a balanced app. So the score is 13. So it gives all the information it needs, but there are certain problems, like it does not give about the clinical teaching advice and black box warning, and it also doesn't give idea about the dose calculator. So these are the disadvantages with the Medscape. Then we have other apps. So technically you can see all these apps are good, but one can select based on need. Personally I recommend to use either Macromedex or Epocrats, because I found these two apps good. So I hope you all must have liked this comparison, and you can also access this article for detailed information. So now if you have liked this video, then you can click the like button, and if you want to subscribe, then please subscribe my channel for more discussion. Have a nice day.